Right now, as you watch this, there is a silent epidemic destroying the livers of 1 in 4 people on this planet. No pain, no symptoms, no warning. Most people won't find out until it's already too late. And here's what makes this terrifying. Your doctor might miss it entirely, but an artificial intelligence probably won't. Non-alcoholic fatty liver disease, or NAFLD, is now the most common liver condition on Earth. We're talking about 1.5 billion people affected worldwide, and that number is rising every single year. Yet for decades, diagnosing it required either an invasive biopsy, a large needle pushed directly into your liver, or expensive imaging that most healthcare systems can't afford. But in the last 3 years, everything changed, because artificial intelligence learned to see what we couldn't. In this video, we're going on a journey inside your liver to understand exactly what fatty liver disease is, how it silently progresses, and how AI is now detecting it with an accuracy that is genuinely changing medicine. Your liver is extraordinary. It performs over 500 different functions simultaneously, filtering toxins, producing bile, regulating blood sugar, synthesizing proteins your body can't live without. But every organ has a limit. When your diet sends too much fat into the bloodstream through excess sugar, refined carbohydrates, or obesity, the liver does something it was never designed to do long-term. It starts storing that fat inside its own cells. At first, this is called simple steatosis, fatty liver, stage 1, reversible, silent, mostly harmless. But here's where it gets dangerous. In around 20% of patients, the fat triggers inflammation. The immune system attacks the liver's own cells. This is called NASH, non-alcoholic steatohepatitis. From NASH, the progression continues to fibrosis, where scar tissue replaces healthy liver cells. Then cirrhosis, where the damage becomes permanent and irreversible. And ultimately, for some patients, liver cancer or complete liver failure. And the cruelest part? You feel nothing until stage 3 or 4. This is exactly why early detection is everything. And this is exactly where AI enters the story. In 2023, a team of researchers at the University of California published a study that quietly changed the field of hepatology. They trained a deep learning model on over 18,000 ultrasound images of liver tissue, feeding it examples of healthy livers, fatty livers at every stage, and everything in between. The result was an AI that could stage fatty liver disease from a standard ultrasound, the same basic scan available at virtually any clinic in the world, with an accuracy of 91.3%. For context, experienced human radiologists typically achieve around 79 to 83% accuracy on the same task. Let that sink in for a moment. But the California study wasn't alone. A landmark paper in Nature Medicine in 2022 demonstrated an AI system trained on routine blood tests, ALT, AST, platelet count, data most patients already have, that could predict significant liver fibrosis with an AUC of 0.92. This is critical because blood tests are cheap. Blood tests are universal. Blood tests require no specialist, no biopsy, no expensive MRI. What this means is that for the first time in history, mass screening for silent liver disease is becoming financially and logistically possible. And the technology is accelerating rapidly. In 2024, researchers at MIT and Massachusetts General Hospital developed a multimodal AI, one that combines imaging, blood biomarkers, and patient history simultaneously, and achieved staging accuracy that matched liver biopsy results in 87% of cases. A needle biopsy, without the needle. So how does an AI actually see fatty liver disease on an ultrasound that a human radiologist might miss? The answer reveals something fascinating about how machine learning works, and why it is fundamentally different from human perception. Human radiologists look for macroscopic features, obvious changes in size, echogenicity, visible nodules. But the AI was trained on tens of thousands of images and learned to detect sub-millimeter textural patterns, Tiny variations in how sound waves reflect off fat-laden versus healthy hepatocytes. Patterns that are below the threshold of conscious human perception. It's not smarter than a radiologist in any general sense. But for this one specific task, pattern recognition across enormous data sets, it has trained itself on more liver images than any human could examine in 10 lifetimes. Now, and this is where it gets clinically important, the AI doesn't just say fatty liver, yes or no. The most advanced systems provide a fibrosis 4 index, a NAFLD activity score, and increasingly, a predicted progression rate, essentially telling the physician not just where the patient is today, but where they are likely to be in 5 years without intervention. This transforms fatty liver disease from a condition that was managed reactively, we'll see how it progresses, into one that can be managed proactively, with targeted lifestyle intervention, medication timing, and surveillance frequency, all calibrated to the individual patient's risk profile. One study from Stanford, published in Hepatology in 2023, showed that patients whose fatty liver was AI identified at stage 1 or 2 and immediately enrolled in structured lifestyle programs achieved complete histological resolution in 42% of cases within 18 months. 42%. Complete reversal. That is a disease that essentially disappeared because it was caught early enough. So, what does all of this mean for you right now in 2025? First, this technology exists, but it is not yet uniformly available at your local clinic. Several AI-powered liver assessment tools have already received FDA clearance, including systems from Perspectum, Echosens, and Siemens Healthineers. If you live in the United States, the UK, or Western Europe, there is a reasonable chance your hospital has access to at least one of these. If you are concerned about your liver health, and given that 1 in 4 people have NAFLD without knowing it, you have statistical reason to consider this. The most important step you can take today is to ask your physician for a liver function panel and a FIB-4 score calculation. The FIB-4 is calculated from routine blood work you may have already had done. It is free, it is validated, and increasingly, AI systems are being built around it. A score below 1.30 is reassuring. Above 2.67 warrants urgent specialist referral. Second, within the next 3 to 5 years, AI-powered liver screening is expected to become integrated into standard annual health checkups in most developed healthcare systems. We are at the beginning of a transformation in how this disease is caught and managed, and the patients who will benefit most are the ones who understand what's coming and ask the right questions now. Fatty liver disease is silent. It is common. And for most of human medical history, it was caught far too late. Artificial intelligence is changing that equation, not in some distant science fiction future, but right now, in hospitals and research centers around the world. The liver can heal itself if given the chance. The question is whether we find the problem early enough to give it that chance. If you found this valuable, subscribe. Because next week, we're going somewhere even deeper. We're going to look at how AI is now detecting colon cancer polyps during colonoscopy in real time, with accuracy that is genuinely making experienced endoscopists reconsider how they work. It is one of the most remarkable stories in modern gastroenterology, and I'll see you there.